So I wanted to talk to you about one of my favorite topics in surgery of the face, neck lift versus facelift. What is the difference? Sometimes people are asking for improvement in their neck, but what they're really looking for is a facelift. So there's a few ways that the two are different from each other. Neck lift is very variable. So depending on how much extra tissue there is, some people have more fat, some people have more skin, some people have loosening of muscles, some people have platysmal banding, which are these little bands that forms in our neck with time. People with weight loss patients sometimes have just a lot of loose skin and have a combination of all of that. So what do we do? Now, for somebody who doesn't need a whole lot, sometimes we could get away with something as simple as just doing liposuction of the neck and some type of a skin tightening procedure like radiofrequency or J plasma. For people who have more tissue, sometimes we need to do an actual open approach where we basically make an incision in the below the chin, and then from there we go ahead and we try to remove fat, we try to fix the muscles, bring them together. This is great for people who have those bandings but don't have a lot of tissue. But ultimately, for people who really have a lot of tissue or require better improvement, we need to make incisions around the ear as well. And now we have to combine incisions around the ear and possibly with an incision underneath the chin. That the incisions around the ear don't have to be too extensive. They usually start right about here in the ear and go right behind it. And through those incisions, we can move everything up and then basically suspend the muscles and do what we need to do for creating a really nice looking contour to the neck. Now, if that person needs a facelift, this approach would be extended to include the mid-face as well. So really, between the most extensive neck lift and a facelift, there's only very subtle difference. And that difference is, for the most part, the degree of dissection that we have to do in the cheeks, and the fact that we also, in addition to the neck, are going to be fixing and suspending the cheeks to allow for all the folds and for all the droopy fat in the face to be lifted. Many times we also combine that with fat transfer to the face to create a more youthful appearance to the face. So if you think that you may benefit from any of these procedures, please ask me or any other plastic surgeon, and we can guide you through those sequence of procedures.